All right, Town Council special meeting, March 5th, 2026. Can I get a roll call?
Holloway present.
Present.
Grossman present?
Ashworth present.
Buckles present. Let it be known we've established quorum. And we have Mr. Newman that showed up.
Newman present.
Newman present. Newman present. All right. Our established quorum is take a moment of silence. Pledge allegiance. All right, I pledge allegiance
To the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Alright. Do we have, is that right? This is a special meeting, we have public.
This is a special.
Yeah, we have both.
We have,
Yeah, that's our agenda management software. It puts it on there every time, and there's no way I can take it off.
yeah, because normally we don't have it.
Yeah, we don't.
So skip that,
Yeah.
alright, order of business, 2026, 2027 employee health insurance presentation and renewal. Yes.
Jody.
Hey. Never very good with the microphones. Is it on? Can you hear me? You can hear me okay? Okay, great.
I don't know if the crowd in the back can hear you.
Okay, all right. So look,
We can hear you.
good evening and thank you all for being here. I know this is absolutely your favorite presentation of the whole year because health insurance is just so exciting. So with the jokes aside, I kind of want to use the opportunity, since y'all are in front here, to tell you something really important. Staff appreciates your support. And they truly, truly do appreciate all that you do for them. You've heard me say this before in every presentation I give, but our employees are the most important asset that we have, and they are the ones that make things happen. So, you can vote for a $50,000 beachcomber, but, we need a town employee to drive it. He needs to operate it safely. He needs to be efficient, and he needs to take that with pride. So it's the town employees who do this. Being able to hire exceptional employees, retain exceptional employees, and teach and develop staff, that's got to be our priority. So Rick speaks every day about excellence. Every day talks about excellence, about values and accountability, and asking everybody to embrace change, think outside of the box, and be our very best selves. And strive not to just provide outstanding service to the public, but to embrace that service. So, and it's your support tonight, that make these initiatives possible. Whether that's an extra day off during the holidays, supporting a strong benefit program, or recognizing the importance of competitive compensation. It's your leadership that makes this all happen. You can see it really just by walking through the halls of the town, the new town hall that we have. You can see employees who care. They're very positive, and they remain steady under pressure. And most importantly, we take ownership of the mistakes we make, and we learn from them. So I just want to tell you just a really quick little thing, because I know get us out of here, but just about our employees. And I'm just so proud of us. I really am, every day. And I sit across from finance, and I run all over the place, and I love these people. But last Thursday, we were invited to go to the career fair at the high school. And about a week and a half out, I asked the supervisors first if it was okay if I tapped on their staff. And yeah, go ahead. I asked staff if they would like to participate. And they were so many people Jessica was jumping up and down, pick me. And Jack wanted to do it. And Rick Finley was excited. We had so many employees that really wanted to participate. And so it's the morning of the job fair. It's career fair. It's raining. It's awful. I get there right at 8 a.m., just like Ms. Turner said. Be there at 8 a.m., slogging through the mud and the rain. And I get up there, and it's 8. I'm on time, and I'm standing in line. You have to check in at the high school with your ID and all that. security. I'm like, oh my gosh, where is everybody? I was like really nervous because there's no Jack, there's no Jessica, and there's no Rick Finley. Like, oh my gosh. And then I weave my way through the high school, as you know what that's like today. And I get into the gym, and they all are. They must have gotten there at 7:30. They were all there, the entire table set up, and they had made the most amazing handouts for the kids. Nobody asked them to do it. Nobody told them how to do it. They did it, and each one in itself was amazing.
That's great.
And to see them jump out of their seats and engage with the kids all day, or almost all day long, and how excited and they weren't doing this because they wanted to get out of the office. Now, this was harder. This took more work. And I love that. I love the community engagement and that our employees want to do this. And that's something I just wanted you to know about. And you'll read it in my report, but I love telling it to you tonight. So,
Thank you.
okay.
Very nice.
All right, so hopefully you've had a little bit of a chance to read the presentation. I'm going to zip through it. Jeopardy starts at 7:30. So the first thing is Anthem. Let's talk about Anthem real quick. And why am I making the recommendation? Why is the town making the recommendation to council to go ahead and just renew? This is the same plan that we had last year for 25 to 26. It is a self-funded, level-funded plan. And the reason that we are going to ask you to renew is because pretty much all the other rates when we did our due diligence were super high. We had, 31%, 53%, 56% increases across the board when we looked at, Aetna, the Anthem, the fully insured, Centera. So it was kind of a no-brainer that we were just going to go ahead and renew because that was, plus employees are happy. I can tell. They're going to come to me and say, complain if there's issues. No, they like Anthem, they want to stay with Anthem. The bundle gives us an additional 2% off. So we decided to go ahead and ask for a renewal. And the great part was that first it came back as an 8% increase, which is a little high, more than I'd like to see, but we negotiated this year, and they listened. And I think overall, we're a good group. We're a good group, and we work hard on that. I'm going to talk about that in a few minutes. So for the employee, it's really marginal when it comes to the increases that they're going to see in their premium for their payroll deduction for health insurance. For most of the employee only, it's like $1. It'll vary a little bit for those people that have dependents. It just depends on what plan they're on. And for the town, well, first of all, no increase in dental or vision. So that was good. I kind of took a different look at it this year. When you could go back and you could look at the whole year, the whole plan year from April to March. And I did a bunch of budget to actual reports. I looked in, payroll deductions. I came at it from a lot of different ways. And it was pretty close to what I had told you about a year ago. We were fairly close. But we go up and down. We might lose an employee and that position doesn't get replaced for 3 months. So you're going to save some money in that. Or you may have a new hire who has a family that's going to cost the town a little bit more. So there's a lot of fluctuations in there. You can't completely guess what that's going to be. But I do know what it is today. And we are fully staffed today. And it's a renewal. So I'm pretty sure that most people, they may make some changes. There will be some changes. But for the most part, I can get a really good feel for what it's going to be in 27 days, what it's going to look like. And so that's really what I was looking at to give you the numbers tonight, not what our whole year looked like or not what I stood in front of you a year ago and asked you to budget. I'm going to give you like March of 2026 to April of 2026. And then we're really going to know what this looks like. And the thing that's good is that overall, just for our Anthem, that would be our medical and our dental, we have an increase of just a little over $6,000 for the year right now. That's like, wow, that's really good. It's a 2.7% increase. And, there are reasons why it's going down. We have a couple employees that are going to leave. They're going, on Medicare. They have another plan. Some have dropped dependents, or child has aged off the plan, those kinds of things. So there's... Two down, one to go. So, and then dental, of course, there was no increase at all, because that stayed exactly the same. So that's, I think that is, it's about as good as we could hope for, considering that, we did have high claims, and we are still, we still have a little bit of an aging demographic. It's just the way it is here on the shore. So I thought this was optimistic. And if you look at, this was fun to look at. I went back from 2020 to 2026 and just ran some calculations. Like, where are we? And right now, we're kind of in the middle. If you look at page 4, we're in the middle. And if you flip to page 5, you can see in this little bar chart that, especially like the past 4 years, we're staying kind of around the same amount. So when you're dealing with escalating healthcare costs every year, this is good news. And I'm going to get to this when I talk about wellness and health, because it's so important that we invest in wellness and health as preventative care, as a way to keep our claims down. Because claims is everything. Age, yeah, but claims is everything. So we did have claims this year. I think the thing is that most of those were like a whoops. Somebody got injured, or it was a one-time thing. It wasn't like an ongoing thing. And the ongoing things, we can't control everything, but we do have some control. We can keep a healthy employee population. We could try. Okay, that's it for Anthem. I'm asking you for a renewal. We're not asking for any changes really to the health reimbursement account. We started that in 2023, so 4 years ago, and employees love it. It's the best thing that we've done. I think, at least this is my 11th year, the best thing we've done. It gives employees a card that we fund, and they can then use that to pay for out-of-pocket costs, like the prescription at Rayfield's, or the glasses that they want to get, or just basic out-of-pocket costs. The HRA it's based on what plan you choose. So the higher deductible, the more in your HRA, the less the smaller deductible, then not as much HRA. I am proposing, because we're going to have a little bit of a savings with our HRA, we came down a little bit in that I would like to increase it for the people that waive the plans. I think that they've earned that. They're not on the plan, and it would be nice to maybe give them a little bit more. So, but it's still not going to increase from last year to this year. So kind of non-issue.
Can I back up with the Anthem piece? How do the employees feel about the program itself, not the deductibles and all that stuff, the responsiveness for
Claims
and all that stuff?
Again, the barometer of that is people will come tell me. People never come into your office to say, oh my gosh, I just love Anthem. It's the best thing that ever happened to me. But trust me, when something's not right, they're going to come talk about it. So, we have not had any issues with claims. I mean, I've used it. My family's on the plan until recently when I kicked one of them off. But, and, it's been really good. The EOBs come quickly.
Okay.
Probably the only pain point is the dental, but that's going to be, no matter what we choose, that's going to be there. That is just dental insurance. Dentists don't want to work with insurance anymore. I prefer Delta over the Anthem. I'm probably going to have to change dentists, but there are dentists that use Anthem, that work with Anthem. So that's probably the only thing. The vision, no complaints, just like it was with VSP. I have not heard any complaints. I mean, Anthem is big, and that's the great thing about working with Anthem, is that you can even get care with your Anthem plan if you're not in Virginia. I mean, there are ways that Anthem works with people. Like if you have college kids that are across the state, so it's a great plan to have when you're spread out. They're everywhere. My son's in Lynchburg for college, and all the doctors there take Anthem. I didn't have to make any special arrangements or take a key care plan, which is very expensive. So, do you have another question, Paul?
No.
Okay.
I have a question on HRAs. Are we, I want to understand, we're funding those versus them being pre-tax deductions? So it's almost like a grant?
So I would love to talk about that. So a flexible spending account is employee-driven. So that's what they will put pre-tax money into. They choose how much they want to contribute in a year, and then it's divided up over 26 pay periods. And that is pre-tax money that they can use for all of the same things at the HRA. We used to only have that, and that was, it's an employee voluntary benefit. It's very, very helpful. If you have a kid who has got, braces, right, big, or you need new glasses. So we still have quite a few employees who do the FSA. It's a fantastic benefit. The health reimbursement account, we own that. The town owns that. And it's nice because we can actually write the plan docs on that. We get to decide how we want to do that. Y'all are probably familiar with like a health savings account that's very popular. That the employee owns, like they walk away with that. So if we have an employee that leaves and they don't use all their HRA and they don't decide to like go use it when they leave, that money comes back to the town.
Okay.
So that is the employer is funding that. And it's great. You have one credit card and your FSA is on it and your HRA is on it, all on one card. The card knows, first use up the FSA because that's a use it or lose it benefit, and then it'll it'll turn right into the HRA. The other thing that's amazing about the HRA is that it rolls over from year to year. Your FSA is like, if you don't use it by the end of your plan year, you're gonna lose it. But the HRA just rolls. So if you have a good year and you really don't use it that year, like you don't have a lot of needs, it will roll and it will grow. And it's nice to have one that's big, because then when something does happen, right, then you got like a pot of money. So, but that's a huge benefit for our employees that it rolls over. But if they leave, it does not go with them. So, anyway.
So this is only offered to employees, unlike the medical that's offered to council?
Yeah.
and-
I have not even explored that, if that would even be doable. Because the thing is, the IRS is the one that determines your HRA. But these are all things that we can look at. Good question, Tara. Yeah.
So you said, though, that it rolls over year to year if you don't use it, but what if you leave or are terminated? What happens to it?
So with the HRA?
Yeah.
With the HRA. So a lot of employees, the ones that understand how the HRA works, if they know that they're getting ready to leave, they know ahead of time, my 2-week notice or 3-week notice. We had an employee who recently moved to a different state. If they're clever, they know to use it, and that's it. They should. It's their benefit. I think that's good. I usually will give them, information on the FSA store where they can go online. Even Amazon, you can buy things online for Amazon. Amazon has a special thing, HSA available. I bought like a humidifier from Amazon, and I use my HRA money. So, but some don't, and then of course it just does not incur an expense for the town.
Gotcha.
Yeah. I know you're like. So I think the big change, because I know you said, to come in and not a lot of changes, is we have a telehealth plan right now with Revive, and as an administrator, it's really a bit of a nightmare, but that's not the reason I would say no to it. I've had a lot of issues. I am actually wondering if they're going to survive another year. That's how frustrating it has been. They're great. You can have an app, you have a little account, you check in, you put in your user ID, and then you can get on there. They're very good with giving you prescriptions. That's kind of what they are. You call up and you're like, and they're like, oh, where's your pharmacy? And off you go and get your prescription. I had the opportunity through our payroll company to be introduced to a physician. His name is Kirk Heath, and he's a trauma surgeon. He's in Virginia Beach, but he's also an entrepreneur. And he started a business a couple years ago, did really well, and sold it. And he said, I'm done being a business owner. I want to go back to being a trauma surgeon. But he got the inkling again, so he started this company called Apios Health. And it's like telehealth, but it's a whole nother level. So he says, he calls it a not a telehealth, but a virtual concierge urgent care. That's what he calls it, because it is for urgent matters. It's virtual, but they're so available and they're so able to help that it's almost like concierge medicine, which is like very high end. The best part about this plan is that you text them. So it's so easy. There's no having to log in, or it's not taking my user ID, or you want your dependent child or your dependent, your husband or wife or dependent to use it, and then it's very confusing when there's other people in the family. You text and you get an immediate response. But they do more than just give you a prescription. They'll follow up with you. Like, how are you doing today? Like, I understand that, you had a rash, and now are you better? So it's much more, it's just more robust. They also can help you to get into a doctor. So we all know how hard that is. Like, you really need to get into that dermatologist. You're really concerned about something. Well, we can take you in 4 years. This is a big challenge for everybody. Whether it's on the shore of Virginia Beach, it's really hard to get in. And they know people, so they can help make referrals and help that happen. Now, we haven't used them before, but I've been able to talk to people and testimonials, and from what I'm hearing, so this is not new. We're replacing a benefit that we have with a better benefit. They still do the prescriptions. You text, I need a prescription. I think that it'll still be the same for the people that are used to Revive. The difference, though, that there's a little bit more of a cost, but you get what you pay for. And this is the one thing that the entire HR department really supports council getting this. It's $14.95 a month per household, and I think that that's something that I'm not in a position. I do not have the authority to approve that, but your HR department supports it. So
is it all through text?
Mhm.
And if they refer you to somebody, is it somebody that covers Anthem?
Yes, you can ask for that. You can
Okay.
ask for that. Again, here in this area, like, everybody's going to take Anthem. So, we know Centera is covered with our plan. We know that Riverside is covered with our plan. That's always like an absolute necessity, that when we're looking at health insurance, that Centera is in there and Riverside is in there. And, obviously rural health is, because they're federally funded, so they have to take all the insurance. But, it would be a pilot. I can't say, oh, I've done this before, but from what I've heard, that this could be very good. It's always like, how can we make something better? And I would also really like to see employees use this. And I think by making it easier, that it'll get more use. There's also, and Kirk was really explaining to me, like, the whole ROI on why this is important, and I put some of that in your packet, because again, like, keeping people out of the emergency room when they don't have to go to the emergency room really helps our claims. And there's a lot of times that you don't need to go to the emergency room, like you find out that it's just an ear infection or whatever it might be. There are times, obviously, that you got to get a bandage, you got to go, but he's got all these statistics and how it can really help us to lower our claims. These are all things that I'm thinking ahead in the future. Like, what can we do to keep claims lower? Because that's the secret ingredient to having good costs, right? And so, hopefully 5 years from now, we're going to be saying, or less, 18 months from now, we should see. I even see a difference. It's not quantitative. I've not really been able to measure this, and I like to measure things because I'm a numbers person. But I think that one of the reasons that we had a pretty good renewal is because we have invested in our wellness and health. And it just people start to talk about it. I had an employee come today with her wellness and health incentives. She got all her 10 points. She actually got 11 points. And so she's now excited about, eating healthier and trying to exercise more and drink more water. It takes it's like opening a restaurant. Don't expect success the first year. Like I know anything about that, which I don't. But it takes a while, right, in order for it to kick in. You can't expect to start a plan and then next year, it's like, it was magic, it worked great. It takes a couple years for the water cooler talk, like, oh, I'm doing this walk thing with my phone, and I'm, trying to get my steps in because I'm doing the wellness and health incentive. So, anyway, so that's about Appios. And again, I think this would be so great for you all as elected officials. The thing is that we are in a difficult place here on the shore. We really are. It's like 9 o'clock at night, you have a sick child, or you're sick. And what's your option? You're going to go to Virginia Beach, if it's that urgent, or the emergency room. There's no place, we don't have urgent cares here. We have one up and only, and they're crowded as all get out, or you go to Virginia Beach. And so these virtual plans are great for everybody, everywhere, but for us, they're a must. They're a must, because, you have to get in a car and drive an hour just to get to an urgent care. So Dr. Heath and his crew may say, you know what, you need to go to the urgent care. Like, I can't help you virtually. But isn't it good to try? It doesn't cost you anything. So, anyway. Any more questions on?
What are we paying with the current group that we're using?
So
3,000.
it's about double. Yeah, it's about double. It's $750 per employee, and now it's going to be $14.95. Yeah, so it's about $6,000 some dollars a year.
But you're also suggesting we add more people to the plan as well, right? You're advocating for that?
So the same amount of people that are on Revive would be on Appios. Like, we're not adding more necessarily. If we have 38 on Revive, we're going to have 38 on Appios. But I am suggesting or supporting if council wanted to do that. But I feel like kind of out of my element, and even like it's probably above my pay grade to say. But I just think this would be a nice thing for council, because council, y'all don't advocate for yourself. I've been here, this is my 11th year, and Libby's been here a lot longer than me. I don't think you've had a raise. So why can't we give you Appios Health for $14.95 a month for each of you that you can use for your family? Like, I think you deserve it.
In addition to everything else.
I don't know.
No,
So,
I appreciate you bringing that
I
up.
would like you to vote on it. I mean,
Yeah.
I would like you to vote on it.
How many people have used the Revive?
How many? I think we had about around a 10%, 9% usage.
Okay.
And it's, it is kind of a pain. I mean, I was trying to get my son to use it one time. He had something wasn't feeling well. And it was just so hard with the logging on thing. We also have what I like to call not apathy, app exhaustion.
Yeah.
I mean, I look at my phone, I'm like, oh my gosh, I've got my Bird app, and I've got all these apps, and I'm just tired of all my apps, but I do like my Bird app.
Except for the cats.
Yeah.
But it's just like
Cat
crazy.
entertainment. Yeah, exactly. Yeah, it's for cat
So-
entertainment.
But I don't know, I'm tired of portals.
Yeah.
Like you go to, I have Rural Health,
Oh,
and
God, that's just
Centera, and
Yeah.
I have like 5 just for health. And I can't remember my password, and then I don't use it for a year, and then it changes. I'm tired of it, I really am. And that's why I wouldn't use it if I have to use another portal. But a text, here's the thing. We can cancel this at any time. If we do it for 3 months, 4 months, and we hate it, we can cancel. So it's not like we're stuck for a year. I'd like to pilot it and see how people use it and get the feedback that people, I did get good feedback. on
Pilot it
Revive.
through us,
Hmm?
through us as a town, or the other
The whole
employees.
town.
You can sign up with everybody up front.
Stuff. But so, that's where I'm confused. Right now, there's 38 people on Revive.
Mm.
Are we on Revive?
No,
No.
Okay, so there would be more people
yeah,
on Appios.
Yeah.
That's what I was asking.
yeah. We would be
Okay.
38 plus
Plus
7.
Okay.
Yeah.
It's
And, the thing
180 a person,
Sorry.
180 a person, right? $14.95 a
Oh, for
month.
the years.
Times 12.
Yeah.
It's 180.
Yeah, I mean,
Okay.
Yeah.
that's, and so, we could,
I don't know, I can get a couple drinks with that.
Where?
Yeah, exactly.
Less than a couple.
Couple teas.
so, and actually, Kirk is going to come to our open enrollment meeting on the 11th, and he's going to present it to the employees. I want them to hear it from him, and I want everybody to bring out their phone and just, put the text thing in.
Yeah.
And so, again, I did send out an email that y'all are invited to these meetings, and that would be one that I think would be pretty cool to hear after you vote yes.
So Rick, how does that happen? If we elect that that's something we would want to add as a cost for us to be included, who has to bring that forward? Do you have to bring it? Does one of us have to?
No, it's us.
Well,
Yeah.
tonight,
We have to?
Yeah, you just vote
Make a
on it.
motion right now.
You just make a motion, you vote on it.
It's us.
Okay.
You
I didn't know if
can.
there was a separate,
No, it's,
I mean,
it's the
Libby
same,
might-
it's the same thing that we had over the years. Actually, no one here. When we were voting for ourselves for raises, we
Yeah.
had two staff on council, and they were voting for their own raises.
right.
So that was Sambo and Gerald. So, you know, we've gone over, Libby's done this, I don't know. You haven't pushed it as much, as you,
Well,
you always do every year, you bring it up.
I'm not in this year's budget too.
Yeah, so, and we
Oh,
always,
sure, when I'm leaving,
and we always,
I tried it last
I know you
time and
did.
you just shot me down, so it's
Yeah.
like, okay.
we all do
I
this
didn't.
because we
I
all,
was pushing for the raise, because I'm sorry, going out to dinner at least once in 6 months would be nice.
The McDonald's coffee, you can now get McDonald's coffee and breakfast. And breakfast and
Exactly.
So,
this
it's up
is-
to us, really.
Okay,
Yeah.
gotcha.
It is not, this is not a raise. This is a benefit,
Yeah.
you know, and we're gonna try it. If people are unhappy with it.
You know what, we could have some pretty big elections coming up.
I do have a question, that's a little more serious.
Load it up.
Is he local? Maybe I missed that?
Virginia
Is this
So
Appius?
he's in Virginia Beach, but
Okay.
it's a national company.
Is it? Okay, that's
It's a
what I was
national
curious
company.
about, if it's
Just the
national.
luck of the draw.
Right, that he's local.
And so our payroll vendor, Payday, they are located in Virginia Beach, they're also in Texas, and they're in Florida and New Jersey. And I did a conversation with them, a conference call with Payday, because they have like an HR thing, and we were talking about different stuff that they have that I could use. And she was telling me about this.
Okay,
So that's how I learned about it.
okay.
And that is like the best recommendation I could possibly get from you from Payday.
And is it a household benefit or just
Household.
individual?
and how are you bundling the total for this? Everybody you're expecting to be signed up?
Oh, I think, yeah, if it's a town paid,
Right.
people are all gonna wanna sign up, but believe it or
Okay,
not,
okay.
I had a couple people who did not do the Revive, and there might be a couple people that are like, yeah, I don't need this. Well, we're paying
Okay,
for it.
okay.
You
Just
pay
want to
for
know.
it anyway, though, right? You pay for.
Well, we would pay for only the amount of people we have on it. So if we have,
Okay.
if out of 38 full-time employees, we have 32 that sign up, we pay for 32.
Got it.
Oh, that's good.
Okay.
Yeah, you only
Yeah.
pay for what you have.
Right.
Yeah, it's not like, this is your population, then you pay for that.
Sure.
They can still opt in, opt in.
Yeah.
So,
So if some of us elected not to do it,
we wouldn't pay
so,
for
because
it.
Paul, can you text from your flip phone?
Yeah.
So really, it would only be the 6.
I think they probably have some kind of workaround.
Even they're gonna
I think the next illness
hit the
puts
button
me in
4
the grave.
times.
I got one left.
That's good.
I got one left.
All right, I'm sorry to derail you. You were moving so nicely until.
It's like, yeah, okay, I gave you a lot of information about Apios Health in your, and now that you have a real, like, vested interest in reading that, you can read about how it works, and also, I have another appendix which talks kind of about, you know, the benefits to the employer, the savings, the claim reduction, and that, you can read that. Okay, let's just talk about like costs all across the board. Medical, dental, HRA, the virtual medicine, called Appius, and our waivers. The total increase, including the medical, which we told went up $6,189, the dental, the HRA, which came down by $1,125. The virtual medicine was the big one. That was the big increase of all of them. And then waivers, I just threw a little bit more in there. We might not need it, but I'm padding that line item a little bit. Is an annual increase of $9,902. Now that'll come up a little bit more for council. I think we have a little bit of room to work with because we're only at a 3.2% increase. And that, again, is today versus tomorrow. That's the best comparison. I don't want to compare, to April of last year. I want to see what it really looks like. What are we paying today? So,
Is the waiver only if you go on Medicare, or is it?
no, we have employees that waive for different
See,
reasons.
Right.
Yeah.
I wouldn't sign up for me, because I'm on Medicaid,
Right.
Just Medicare,
no,
Medicaid.
Kate.
Really? Okay.
I don't make
I
that
think
much
you
money
still
at work.
can, but those are really good plans.
Yeah, because I don't have any deductible, none, zero, nada.
Yeah, yeah. But what if you wanted to call somebody at 9 o'clock on a Friday night? What if you were not feeling well and you were like, oh my gosh, do I,
Just go to the emergency room.
You
Just like I
gotta
did when I
drive
chopped
across-
my hand off.
It's a little different.
Well,
You're
that's
not gonna
different.
call someone
What if you
else.
just have a cough or something, you just want to get a medication?
you're not gonna have a hand to use the phone.
Well, see, how would that work,
How do I
though?
sew this
How would that
again?
work? No,
If this
it
is
says
separate-
lacerations, they don't do sutures over the phone.
No.
This is,
It would just be $14.95, you would just have the service.
No, I
I
get that.
stitched
just
my
service.
dog's ear back on all by myself.
Oh,
No,
wow.
what is it if I get, they can send in a prescription even though, but I would use my other stuff for it.
Right, to pay
Yeah.
for it.
Yeah, but how to pay for it, but they could get it in.
Yeah, you
All
still
right,
can
well,
use
maybe
your,
it'll work.
Jeez Louise,
you still can
that's
use
what-
your
Maybe it'll
prescription
work.
card. You still
Yeah.
can go and use your
Yeah.
prescription card to pay for the prescription.
Yeah, I
Right.
just happen to be in a weird
Yeah.
place because
Well, if
I'm
you
just-
want-
it's business, it's a shuffle game. that's
I know,
all it is.
if you want, we can talk about it separately.
Yeah.
I can put you in touch with Keith. I don't know what your day is like on Wednesday, the 11th, if you want to come for one of the sessions and talk to Dr. Keith. But why don't we take that out, because you don't have to decide
Yeah, I know.
tonight, how we're just going to vote it and then.
Yeah, because I'm not opposed
When
to
on the
it,
11th
but-
did you say you sent that out?
So, yeah, Wednesday, the 11th, is open enrollment meetings. We have first one is at 11:30, and then the next one is at 2.
Okay.
Yeah, I had sent that email just a little while ago I sent it to council and to the boards, to the W4 boards?
Yeah.
The pay boards?
Yeah, so-
Yeah, I didn't get any pingbacks, so. All right, that kind of wraps up the health insurance. I'm going to just talk just real briefly about wellness and health. This is something that I'm very, very passionate about because I think this is a great investment in our employees, an investment in their health. We started a couple of years ago, we started a plan, I call it WHIP, Wellness and Health Incentive Plan. And you all voted on that, and we budgeted for that. That it is just an in-house wellness plan. I mean, Anthem has one, and I mean, these are very common, but we kind of tailored it to us, and you have points for wellness and you have points for health. And as long as you get 10 and you can substantiate those in a HIPAA, in a HIPAA way, then you can earn money that can go into your HRA. So you can earn up to $350 for your HRA, and that's what employees want. So they don't get a cash bonus. It's not taxable. It goes into the HRA. And I am also looking to increase the amount that goes into the HRA for every single employee, so that if you're wavering, you're still getting the same amount as all employees. So that I want to change. It used to be you made a little less if you were wavering. So I think everybody that goes to this trouble to do this should get the same amount. So yeah, fourth year, that has been, it's getting off the ground. Every year we get a couple more people that do it, but we have not had full participation yet in it. But it doesn't, other than budgeting for it, the actual implementation of the plan costs nothing. Because I do it in-house. So we're not using a vendor to do this for us. You're looking at me, the vendor. It's great. And we have things like if you play pickleball, if you belong to the Y, if you take steps and all that. We have lots of ways that people can do the incentive program. And we make it so they can succeed. We don't want to make it so hard that nobody succeeds. Otherwise, nobody's going to do it. So we do that. That's part of our wellness and incentive overall plan. The other thing that we started in 2025 is because we had money left over in that budget line, is we have a cost share, a partnership with our Northampton Y. And so currently The town puts in $20 a month per employee, and the Y matches that. So there's $40 off their Y membership. If it's a family, it's $40 off. If it's an individual, it's $40 off. And it's, we had employees join the Y because of this, which was super
What is it?
exciting.
Individuals,
Let's
fifty,
see.
individuals $50, right?
So it's $63
Wow.
for a single person to join the Y, which is a lot. But with the cost share, the partnership with the town, it's 23.
Do we get this?
So we can vote on that. I mean,
Because that
Yeah.
is it, that's an incentive.
yeah, you can vote on
Granted,
that.
I only have,
Yeah,
some
and
of
it
them
probably
are
will
not.
cost it, because some of, not everybody's gonna, not everybody's going to join. But I don't think that the Y is going to mind. I would like to get approval from the Y, but I think that we could, yeah, it is great. And you
We're
get there and
technically
you work
employees.
out and you're a better person all around because you're working out.
And pickleball.
And-
The claims
and-
go down.
And Rick plays
I don't know,
pickleball.
pickleball claims go up.
Yeah, probably.
So, okay,
Pickleball elbow.
the last thing
That's
I'm
not
gonna
bad.
talk about, which I'm also super excited
Very
about,
exciting.
and I've included elected boards on this, so you are automatically
that's
included in
nice.
this. You don't have to vote,
yes.
because it's already done, and this isn't even something that the town is gonna pay for you, it's gonna happen organically. We're gonna do a partnership with Alex Locklear at the Sick Clinic. And basically, in a nutshell, she has agreed that for elected officials and town employees, she's gonna discount her $75 fee to $50. And so when you go, you'll get, it'll be $50 instead of $75. And then what the town is gonna do for our employees is we will do a cost share, kinda like we do with the Y. So for the employees, they will get 3 visits a year, discounted to $25. And Alex and I have been talking about, we were talking about this morning, about what that's gonna look like and how the town will pay for that. And I don't think it's really gonna end up costing the town a lot. 3 visits a year is a lot for one person.
What
you
is,
know.
for what?
Anything.
That's
What is
She's like urgent care.
She's like urgent care.
She's urgent
All
care.
right, I had no idea who this person is.
So she
Fabulous.
does
at the
like,
Rayfields.
Oh, I didn't know.
yeah, so,
But it's awesome, like, you know, that combined with the texting,
yeah, they're two very
Those-
different
Like she
things.
could have done
But
They're
that-
similar, but they're different.
yeah.
Because
Unbelievable.
Alex is here, you know,
Efficient.
really Monday through Friday, you make an appointment, and that's in person.
Actually,
Yeah.
So she has been an ER nurse, she was an ER nurse for 17 years. She knows her stuff, but this is not something that she would do for like prescription refills
No.
or her, what is that called, aesthetics, I can never pronounce that word. Where you
For
go in-
esthetician stuff,
Yeah, skin and all that.
yeah.
This is just really for like the cold, the flu,
Yeah.
the pink eye, the rash, the, you know, earache. I mean, you got stung by a jellyfish.
Yeah.
You know, you got a pretty bad cut on your hand. You don't know if it's infected.
I could be able to help Clinton with his rash.
So it's all of the basic stuff. And you go online and
It's very efficient.
you get your appointment
Yeah,
and you
she's
go
right.
in. And it's
Amazing.
outside of insurance. So this is something that if you went to the sick clinic, again, you know, driving across the bridge is gonna cost you a lot of money and a lot of time.
I don't know.
And just
I never
going
get
to
sick.
Rayfields
Not-
like that, you're in, you're out, you're not waiting. It's amazing. People love the sick clinic. And this is like a nice partnership because we're gonna be giving her more business, but our employees are gonna be getting something out of
Well, and
that.
she provides a great service for our visitors.
And in the
When we
summer.
have things that happen in
Yeah.
the summer and
Mm-hmm.
people don't know where, I mean, it is an incredible service for a child that gets cut, you know, down at the beach, you know, or something.
Too much sunburn.
Swimmer's ear, she deals with a lot of swimmer's ear kind of
Yeah.
stuff.
Yeah. And so I like investing
Didn't know
in
that.
her because we want to keep her here.
Correct, and you bring up a great point, I'm sorry, to that end. I guess my concern is, I think this is a great idea, I love it.
Mhm.
Have we, I just wanna make sure that we're not causing her to lose money. So did we sign a contract, like we'll do an upfront fee to her
So
to
are you,
create this relationship.
so are you talking about the $25 discount thing?
Yes,
Yeah,
which-
I've been in to see her twice to talk about this. And if you know Alex, she's gonna tell you what she
Oh, yeah.
wants. She's not gonna be like, oh, okay. She's tough. She's, yeah,
Have 4 kids that
yeah.
we have a little
Yeah,
door
and she
relationship.
did, she also, I know she can say no, because she said that the discount applies to the employee or to the elected official, not to dependents.
Yeah.
So she drew the line in the sand right there.
Okay.
I was gonna ask that.
Council, y'all are elected officials, which makes you different from our boards. Boards are appointed.
Right.
Council,
Yeah.
but not our boards.
Okay.
So that would be just, then she might start to feel like, okay, this is really costing me a lot.
Okay.
And that is something in my presentation that might have been a little incorrect, because we were still kind of working out all the details. But she says yes to the council, I can do the $50. Elected boards, no. I mean elected, I'm sorry.
Yes.
Appointed boards, no. Not dependents. She probably gets a lot of business from the kids. But yes to employees. So I think that, I don't see this as being a high cost. I really, last year we budgeted $6,500 for the wellness program. To date, we've spent half of that.
Right.
So I went up a little bit because I just think I'm hoping for growth. I'm hoping that more people are going to use it. But at the end of the plan year, I have a feeling we're probably going to need to zero out that budget line item. I just don't think that we're going to meet it. Maybe in 2 years. Because again, 3 visits for, I think I've been to the doctor, like that kind of thing, urgent care, like once in 6 years.
Yeah.
So
I mean, I don't, it's kind of rare to go 3
in
times.
keeping though with the concept of keeping our medical costs down,
Yeah,
right?
Yep.
Not for this year, but I'd really like to see utilization
Mhm.
report on this, because it might make sense for us to extend this to dependents
Mhm.
and maybe look at giving Alex an upfront
Good.
amount of money.
Absolutely.
Because parents are still gonna have to take their kids to an ER potentially, and that drives up our health insurance.
Well, they
costs.
can still take their children to sick clinic.
Yes.
But it's gonna cost them
But-
75 instead of
Correct.
50.
Correct.
And most urgent cares, like our plan, an urgent care is $75. So it's the same price. But then you add in the bridge
Correct.
and the gas and the time and the
It
wait.
might be a nicer benefit for our employees who have families, and I know I fall into that category some. But to extend this to them in the out years
Yeah.
to help drive down our medical costs,
Yeah,
so they're
and-
not going to an urgent care and,
And the thing is, like, Alex is outside of our anthem. She doesn't deal with the insurance. And
Right.
in the Appios Health, you can use your insurance, like, for the prescriptions and all that. But these have nothing to do with anthem. And what we're trying to do is keep those claims down.
Exactly.
And people tend to be very emergency room driven. It's like if you've ever gone into the waiting room, which hopefully you don't have to, and I'm there recently. You've got kids with an ear infection, and you've got lots of people in there. I'm like, you do not need to be here. You are you're taking my space. My arm's falling off, and you're here, right? So we want to try to teach people to utilize these services, which will keep our claims down. But at the same time, I'm always very upfront with everybody, and Alex would be, and so would Dr. Heath. If you're gonna go to the emergency room, you're gonna go to the
Oh,
emergency
she's
room.
quick to,
This is not
yes,
this is not kind of a keep you
Yeah.
out of the emergency room, but it's about
no.
mitigating the claims. And the thing is, like, they will send you to the emergency room. They'll call the ambulance.
But the efficiency of getting it done
Yeah.
in the time that you can get it done.
Yeah. And
It's
I mean,
incredible.
if you're having an issue, you're gonna call 911.
Yeah.
This is more for the everyday, the jellyfish stings,
Yes.
the sunburn, the colds, the flus.
Even though she doesn't take the insurances, it'll still go against their deductible.
It's
They're out of pocket.
It's complicated.
Yeah.
It's complicated. There's a lot there that,
But they can use their HRA for Alex,
I
or
don't,
no?
I don't think you're
I don't think you
supposed to.
can.
Yeah,
Oh, she's a medical provider.
yeah, but it gets, Yeah.
Well, I think I fully support it, I think it's great. I just think it would be even greater as another added benefit to our staff, to be able to offer it for
Yeah.
children too in the future. Can I go back to health insurance?
Sure.
Just for my own edification, what percentage of an employee's premium is the town covering, and what percentage is out of
Okay,
pocket?
so we have 3 plans. We have 3 plans. One, the top tiered plan is Gold Plan, Gold Anthem Plan. That is a $2,000 deductible plan, and it has, it's kind of a copay plan. So that's the most expensive plan that the town offers. So the town pays 85% of the employee's premium for that plan. And they pay 35% of the employee's dependents for we call it Plan 1. You can see that, what Adam's holding up. The other 2 plans are very similar. Their cost is not that different. One has a $3,000 deductible, the other has a $4,000. They both have, at 20% copay, co-insurance after you meet the deductible. So they're very similar. The $3,000 deductible plan has a wee bit of a better prescription plan. So that is a good choice for people who have ongoing need for expensive prescriptions. So for those 2 plans, the town pays 90% of those plans and 40%. I actually did, if you were interested, I just brought it just in case. I didn't put it in your packet, but I have here what it cost last year and what it costs this year for employees. So for that Gold plan, an employee last year was paying $42.25 a pay period. It's 26 times a year. And this year they're going to pay $44.95 for that. For family on that Gold plan today, coming up in April, it's $430.47 per pay period. Ouch. Yeah. Yeah. But the nice thing
That's
about
fabulous, actually.
Huh?
That's fabulous. For a
Yeah.
family?
Yeah.
Yeah,
Yeah.
kidding. That's fabulous.
Yeah, well, yeah, I guess but the other, like, and if you look too, one thing about this plan, listen to this. We have some families, we have a lot of employees that are employing children, a lot, because the
Yes.
spouse has insurance somewhere else. The employee and children rates on this plan are so competitive. Like, I cannot believe it.
Yeah.
$165 a pay period for that Gold plan every pay period. And if you look at the $4,000 deductible plan, which is the least expensive plan that's offered, it's $119 per pay period. That's one of the lowest that we have had like in a long time. And that really benefits the employees because we have a lot of employee and children, and we want employee and children. We want them on our plan. So it's good to give them, it's great that we can give them these good rates. So I do have that.
I missed the, I guess, silver tier, or, gold, silver, the bronze tier.
They're both silver. It's gold, silver, silver.
And you do 90% of the employee and 40 of the dependent on
For
the
the silver plans, yes.
Okay. And how long have we covered it at that rate?
Can you say?
Have we?
90 and 40, how long has it been that percentage?
I think this might be third year. So we used to cover the employee-only rate 100%. You all remember that?
Yeah.
We paid 100%. Then we paid nothing for dependents. And there's some issues with that because then we're really having a hard time hiring people
With
that have
families.
families. And then that's a big disadvantage because then we are losing a lot of employees. As a matter of fact, I talked to other towns. I talked to other HR and benefit people. And Mancock came to me a year and a half ago. They're like, how do you do it? How are you hiring these police officers? Where are you getting them from? Why do they all want to work for the town? They were losing them. And one of the reasons was they were asking their employees to pay 100% of their dependent cost. I said, let me share a secret with you and let's see how you can work it out. So what we did to balance it out a little bit is we asked employees to contribute 10%, the 15%, and then we were able to save some there and put that over to the dependents. it makes a huge difference for people with dependents. So that's, I would say, a couple of years. We've tried different things, but for a long time it was, and you know, the other thing I'm gonna tell you, I am a big believer in, you need to pay a little bit towards things, because when you're not
Yes.
paying for it, you don't use it.
Yeah.
You know, and so.
And that
when
was
you-
also the time period when that huge increase in insurance went.
Right.
So we were at a point where we had to do something.
We
I mean,
did,
it was
and
like 43, I mean, it was just
That
crazy.
was the year that we went and raised the deductibles. So we
Yeah.
had like a $500 deductible and a $1,500 deductible.
5 or 6 years ago, right?
Yeah,
Yeah.
those days were,
Yeah.
those days are gone. So we raised the deductibles, and that's when we introduced the HRA.
Yeah.
Because the HRA is not, that, and that's a very stable cost.
Yep.
And so that was a way to get employees. We had people that were very unhappy about that.
It was a tough transition.
It was a tough transition. And paying the little bit in their payroll was not that big of a transition. I think that, I mean, it's really good costs. I mean, when you look at what other, especially in the private sector, you might pay $79 a pay period for, so
I think it's great.
Yeah.
It's wonderful. I think it's great that you pay for our dependents too.
Yeah.
I think I would even
it's a game changer.
champion increasing that, because that's still lower than, you know,
Yeah.
even 50 or 60%.
Yeah.
But if it's a great retention tool and an attraction to coming to work here
Yeah.
and bringing families onto the thing, which is what you want to do,
Yeah.
increasing that percentage of what we cover for deductible
Yeah.
for dependents, I'm sorry, would be great.
Well, thank you for the support. That's good to know. You know, I'm always like, how much do I ask for?
Well, I mean, we hit a wall in terms of how much we can increase salaries year over year, and this is a great way to offset that to some
Yeah.
degree.
Although I would support that too. Or I think that's season. Yeah.
Oh, your page 11, is that the roll-up number of 14? Is that your roll-up numbers for budget
So, yes.
associated with all these
Yeah.
programs, including the APOS and the sick clinic?
Yep. So that's the total cost. The blue band is the total cost for the health insurance with, you know, how much the increase is, 3.2%. And then the green band is the wellness and health initiative, and that is $1,000 over last year. And again, the wellness and health, you know, that's really like a liability because we might not use it all. But
Maybe
with
you
the,
didn't use it all last year.
no,
Not even close.
50%.
What an incredibly positive investment, though, in our,
Absolutely.
Yeah, and again, it's a liability. We may use it, we may not, but I'm giving you good numbers because, you know,
Everybody used it.
yeah, if everybody uses it. And that's how we ended up coming up, and I think this was Rick's idea, and thank you for Rick, we decided, well, we're really not using, you know, the full amount of this budget. And that's when we decided, and Rick kind of spearheaded that, well, why don't we do a cost share with the Y? And that was like that, and that was great.
That was before Mel was there, by the way.
Yeah, it was, yeah.
Yeah, what's her cut on this?
Yeah.
We just did something like that in Colorado, so it's
yeah, it's really just a great incentive. It's so close by.
I
And
actually think the Y is way better than what we had to do before. You had to keep like a log of what you did, and walking and all that sort of stuff, and then you got credit for whatever you did. If you had like a Fitbit or whatever, this is actually a little more realistic.
Yeah. But you get a point for belonging to the, and it's social too. You know, people go and they take the classes and they meet friends, and I mean, it's a wonderful benefit.
That's way better than that other stuff.
Yeah.
Mr. Mayor, I'd like to make a motion.
Yes, sir.
I'd like to make a motion that we accept the staff reports and the total budget as shown on page 14 here for health insurance and wellness and health.
second,
Any other discussion on the motion? All in favor?
Aye.
Any opposed? That motion carries.
Jody, thank you
Thank
again
you
for
very
all you
much.
do. You do
Thank
such a
you.
great job.
Well,
Was it easier this year?
it's a team effort.
Was it easier this year?
Oh, I'm so glad not to do the PowerPoint.
No, I meant figuring this out, because, I know the couple of years prior. it was
Yes,
really a
yes,
lot of
yes,
info.
in many ways it was. But I really, this year, I really drilled down on those numbers. Like, I spent more time maybe on the presentation, but less time on the date, like getting to that point.
Yeah, because you had, 3 years ago, it was like
Yeah, we did introduce like,
Shuffle, yeah.
introducing the HRA, introducing the telehealth, introducing, cost shares and all that. So this year was easier,
good.
but I really wanted those numbers because I knew Paul was gonna be here.
Yeah,
So,
I've already sent this off to the county.
there you go.
so by voting to approve the staff report, did we vote to include our participation in the Appios, or does that need to be a separate?
No, it was all
All
included.
included.
All included.
So that'll impact your actual set of numbers
No,
eventually,
she
but,
hadn't in that
That
number.
number was.
oh, you had that in there already?
Purple, 15%, $8,000, right?
Yeah, no, I did
No.
not put that in there, but we will.
So that'll add like $1,256 or whatever to, assuming we all did, right?
Well, can you please let the entire HR department know how grateful we are?
I will,
yeah,
I will tomorrow when I go into the HR department.
It's still open for us on a full ride,
There.
And you
Jody,
can,
on these things, correct? Still open for us on a full ride with
Not a
these.
full ride.
No, I'm sorry, full pay, sorry.
Yes.
Yeah.
All right.
So,
mine
open,
just
we're
went
in
up like
open enrollment
60%.
now.
Jesus.
If you're interested in getting on one of the plans, and it doesn't have to be, you could do just medical, or you can do just dental and vision, I mean, it's, you can pick which ones you want or all of them.
Yeah.
It's not like all or nothing.
Do we need to re-enroll, or does it just?
So if you're not making any changes, it just automatically renewals. So no changes, love that. But I would encourage anybody who wants to enroll or just learn more about the plans to show up on the 11th. Because that's when I'm gonna have the open enrollment meetings for all the employees. I did send out to the boards and to you all, the details on that. And then, if you wanna enroll, that would be,
When-
not Anthem, but our brokers are gonna be here. I've got Aflac coming too, we do a lot of business with Aflac, that's completely 100% employee paid, the town does not pay for that. But it's great, with the high deductible plans, we really start pushing that, because then you have hospitalization or accident, and it's very good. I mean, if you have an issue and you're in the hospital,
Is Jan is still doing that?
so no, but, there's a gentleman, named Chad Knapp, and he does it, he's wonderful, I really like working with him. But, Janet has hung up her Aflac.
her Aflac hat.
Oh, yeah, that's been a long time.
Yeah, I like working with her, she's great.
Well, thank you again very much.
Well, thank
Thank
you all for
you.
your support.
Thank you.
And I love, open enrollment day, telling the employees that council made this happen. This is you. It's not me, it's not Rick, it's council voting on it, so thank you, and
Right.
time to go watch Jeopardy.
That's
All right, go do
Thank
it.
you. Thanks so much,
Thanks,
Jody.
Jody.
All right, Mr. Town Manager, it's all
Well,
you for comments.
As some of you know, I was sick last week, and I did go to the sick clinic.
Good. Got to
So
see
I didn't know
Dr.
what was
Alex.
wrong, and I wanted to make sure it was okay to come back to work. So she was like, she did all this tests. You don't have the flu, you don't have COVID, but you do have some virus. And she's like, stay home one more day. And it was hard to stay home one more day, knowing that there's so much work piling up. So, but as you see, I'm back. It was just a normal red over type of virus, cold kind of thing. So, but been working really hard for the retreat. So Katie and Bob and I have been working, dividing up responsibilities. So I'm really looking forward to this. It's going to be great. And budget stuff. We've been working with departments, trying to anticipate what department needs are, and just been very, very busy. I was trying to get out my manager's report. I'm trying to get it out today. It did not happen, so you'll get it tomorrow. So everything's done except for my section right now.
All right, what, question for you.
Sure.
It's just because I saw the flashing lights. So
The what?
March 18th, they're starting the water, right?
Starting the water?
American Water.
Oh,
The flashing what lights?
VDOT lights. Casat Parkway is gonna be closed down.
I
which
saw
means
that.
They're digging. Just so everybody knows that. I didn't know if you knew that.
Oh, no, I didn't know
Speaking in
That's great.
code. You're speaking in code. You started
Yeah,
the
the-
is
mid-sentence.
this for the,
I always do that.
You do, and I'm like trying to follow today, and I
yeah,
can't.
is this the water line? Okay,
Yes.
okay.
That's why they said Casat Parkway is closed down on
Okay.
the 18th, so that means they're digging. So I think we need to start reaching out to anybody that's in that route, like the brewery, and let them know.
So I think the brewery's well aware.
Yeah, no, this is not good. This is exactly what I was trying to avoid.
Where is it,
Yes.
help me to visualize where, because I always turn on Parsons Circle, and
It's
so
not
I,
gonna affect you at all then.
well,
because-
I'm not
No,
worried about
she's just
me.
trying to
I'm
understand.
trying to understand, thank you for decoding my
I
statement.
still haven't decoded because I didn't see the sign.
I'm trying to understand when you're coming down Stone Road,
Yeah.
are they closing it when
Yes.
you turn left?
Yeah.
How is that gonna impact the brewery? Just help me to know.
Because they're digging that whole corridor up, they're gonna go through their parking lot.
They
to Put
are,
that water line
okay.
in there. And that's why I was trying to get this done way in advance, but between,
So they're starting at the water
Canoni
plant,
and-
and they're coming through the brewery.
So they'll be the
Parking
first
lot.
dig.
Okay.
supposedly, I don't know if they are the first thing, shutting the park, they might be doing it backwards. which is gonna put
Wait,
it
their
in-
first dig is where, you say
I,
that?
it was supposed to be in front of the
Supposed to
brewery.
be in front of the brewery that way, but I don't know if it is.
I can call Matt tomorrow and find
So-
out. I thought it was still,
Yeah, I will reach out, and what we can do is we'll put a statement out and try to get in touch with the local business and people, so they'll be
Yeah,
aware.
it's
So we'll
really-
put
it's
something
really
out.
gonna affect the brewery.
Well, can we do the opposite? Can we actually call VDOT and say,
Yeah, that's
hey,
what-
you have to do it this
No,
way?
VDOT has nothing to do with it.
Because
Well, I
we're
think-
doing American
I
Water.
think, but it says, but it says Cassan's closed on the
He
18th,
did
correct?
say VDOT, and that's why.
VDOT sign, VDOT sign.
Yes, but you're speaking in code,
All right, so the
flashing
VDOT
code.
sign is there that American Water and put up.
But what I'm saying is it says the 18th it's gonna be closed. Maybe they're gonna dig where it doesn't have to be closed beforehand, and that's when they're gonna be closing Cassan. That's what I'm
They're
saying.
crossing
Well,
over
can we
Casat.
Can we call?
He's got it.
He's got it.
Yep.
Water
I've already
and
done
say, here's when you need to do it?
Right, because
I'm
I
gonna
think
try to
that the
get them to-
brewery
I
has
would
a
do the brewery
St.
first is what
Patrick's
I'm
Day
gonna try to
event.
I think it's the way it's set up. I don't think you're gonna.
Yeah, you just gotta find out what it is and that way we can inform what's going on. There's no way we're gonna deal with their scheduling. Cause
What's
it's
it being
done,
dug for? Did I miss something
the
coming?
water,
next?
Keck Wells
Check Wells Water.
being hooked up.
Oh, okay.
The $500,000 we
Yes, yes.
put out
There
2
and
years
brings it
ago.
back.
Right.
It wasn't 2 years ago, but it was.
Because Canoni was digging in and being a bunch of jackasses for who knows how long,
All right, any other announcements?
so.
No,
You're
I can
How
do-
about housing? Can you talk to the housing
So-
proposals?
So we are gonna be doing executive session on our regular session in March, so that's the 19th. And we're gonna bring 4 proposals to you and let you look at them
And you'll get the proposals beforehand.
beforehand, that's correct. So our goal, Bob and I were talking about this the other day, we'd like to send them to you electronically, because it's a lot of information. If you want them printed out, please let me know, but I'm planning on not printing them unless you request that.
May I have a printed
I
copy?
want a printed copy.
I do not need a printed copy.
Okay,
So an executive session following our regular meeting?
Correct.
So a
And
nice
that-
long,
We
Can-
also
can
have the
we
harbor,
limit-
we have the beachfront master plan too.
yeah.
it's a lot.
It's a lot on
Then
one night.
can we also have dinner provided
Yes.
going into executive session? Because we're gonna be late and, you
It's
know,
hard-
can't
it's
be 10 o'clock
impossible.
at night to go home and eat dinner.
Well, we don't make
And
the
I'll
decisions.
be calling in for that one. 'cause I
We'll
won't
have
be-
dinner
I'll be
provided.
in Atlanta.
Okay. So, but we did ask for Ricky to provide for the beachfront master plan in advance.
For sure.
Also.
And I'm gonna follow up on that too.
That's a lot of lots
It is a lot,
on one meeting.
It is.
it is a lot.
Big
That's
You
a
stuff.
saw what happened last time when we had
We've
one.
done it
Yeah,
before.
go into zone.
We just follow.
Yeah.
Could the beachfront master plan be
Yeah.
a special, a work session like 2 weeks later instead?
We've done this plenty of
If
times.
council, if you would rather me move that beachfront master plan final to, April, we can do that.
I
Or
think
what if we did executive session the next, well, now it's Friday, we're not doing that.
But, or like a work session in April. Do we already have one for the budget for on the 2nd?
April 2nd is a budget work session.
Okay.
I feel like the beach can go at
Yep.
another 2 weeks. I don't know. Does anybody else?
We don't-
I mean, it's been this long, what's in
If
2
we
weeks?
have-
Paul
Okay.
agreed with me.
I brought it up. Yes,
Yeah.
I know.
So can we push the beach?
It's a lot for them.
It
I
is.
will-
It's too much.
I will request that to be changed.
You know people do
Okay.
show up.
So,
So the next, so the 19th would be housing and
Regular meeting.
regular meeting, but Davenport, someone said too, right?
yes.
And,
And executive session.
Katie's got the
Berkeley?
annual board reports for all of the boards.
Oh,
That's
Lord,
what it
yeah.
takes.
Oh, good
Yeah, that's
gracious.
enough.
We
We
were gonna do
definitely
all
gotta
that in the night? No. that's
Definitely gotta
crazy.
move
Be here till midnight.
the beach.
Okay, so hold on, so what are we gonna, let's agree now, right? What are we gonna do? We're gonna do Katie's presentations, we're gonna have Davenport, we're gonna have,
We can move Davenport's too if I can try to do that put that in April.
With the beach?
Yeah.
yeah, what was the other one? The other one was what? Was railroad
boards.
project?
Oh, that's the financial.
Boards.
Board, so
update.
Katie's boards, housing,
And if we get Katie's report ahead of time, we can use a very brief
Yeah.
summary
Yeah, we don't need that whole thing.
rather than blow by blow.
yes. It's just, the housing needs our undivided attention and we will
Yes.
be toast by the end of the other
Right.
stuff. I mean, I'll be totally jazzed.
You'll have your Rolos.
Okay.
Thank you.
So we'll cut the beachfront master plan and what was the other one? Oh, Davenport.
Davenport.
To April.
All right. So the only challenge is it's they were trying to plan it on when they were going to come to inform you. I can make the request and say, council, we're just too busy. Can you come at? So they may not be able to come that April. So I'm just going to have to try my best to get it in.
Or just make it a special meeting if we have to, for the beach and Davenport.
Okay.
Yeah, I would do that.
I don't think Ricky
So
will care.
we may have another executive session from John Kemp. Would like to discuss a topic which I can't talk right now. I'll talk to you individually. So,
And that would be in April as well?
most likely, yes.
Okay.
It's gonna be the same thing. I know
But we could
exactly what
do
he's
a-
gonna do.
But we could do a executive session just set
Oh,
up
tell me.
on a Thursday
Give me a
night.
finger.
That's not the regular meeting.
Correct, yeah, it could be a special called executive session.
Yeah.
I'll give you plenty of time. And in our individual meetings,
Yeah.
we can talk about it.
Okay.
I'd like to kind of give you an update on harbor and rail yard master planning. Tara, please just jump in at any point. So you can find this information on the planning and zoning page. And then on the left side, go down, click on railroad and harbor area master planning. So it says here materials from Tuesday's meeting weren't online. They were put online at 4:15 this afternoon. So we did have this information that you can see here prior to the meeting. There was another whole set of slides, the framework, we were not given ahead of time. And so we saw it at the same time as the public, and it's all those same kinds of issues
no.
that we always have when we're trying to make decisions and we haven't seen information.
Oh, that's frustrating.
So, yeah, and, you know, the first set of materials, which were the master plan guiding principles, the comparable analysis, site conditions, those had been provided to us through a link, but it wasn't out there for the public to see. So, and that should have been on the website, so members of the public could have seen it prior to the meeting. Anyway, about 123 people participated by giving input one way or another, either at the meetings or through the survey. And the Berkeley group took that information and came up with 5 guiding principles for developing the master plan. You can see those there. Extend the historic town pattern with compatible design, support balanced small-scale mixed-use development that reflects Cape Charles, create a connected network of open spaces, trails, and plazas, prioritize public water access and protect the working waterfront. And this area should serve as a connector in the town and an economic catalyst. They gave us 5 maps. I've only put 2 on here. I think these 2 kind of sum it up. The best, when we eventually get the framework, those are much better slides when that gets posted. Take a look at those. But you can see on the top map, this is where they were looking at how development might occur through the site. The easement area, which is in green in the bottom one, is not colored in on the top one. But the thought was bringing primarily Peach and Nectarine across as connector roads. We did talk about, but nothing, there was no decisions. We actually have to give a lot of feedback early next week. I had suggested to Katie that the committee meet again to discuss in person what we thought, what we saw, so that it's not just each one of us turning in one piece of paper. But possibly Strawberry continuing through as a pedestrian mall. Picture the mall in Charlottesville. And, having that going through that space.
Like
could-
to me, that is critical as one of the things.
It's on one of the other maps,
Okay.
Strawberry
Only
coming through.
part way, it doesn't
Yeah,
show it
as
all
a
the way.
plaza, but
Right.
it does come through.
Yeah, I
No.
think that of all things, that to me is one of the easy, clearest one that needs to be
Right.
there.
It's there, it's just
Okay.
not coming up on these, because I thought they
Okay.
had all of the streets, Nectarine, Plum,
They had that in,
Peach, Strawberry, and I also thought they did Pine.
well, they did in an initial set, but when you got to the framework pictures, which we don't have copies of, Pine was out, and there was some question about some of the other ones.
And they also have cross streets on one of their maps too, correct?
They tie into Fig or something?
No, because I can't see it, but there was at least one cross street that went perpendicular to Mason.
And it may have been, oh, I know what it was. So you see the yellow line? That was extended out along the side of the easement and then connecting into Old Cape Charles Road.
Yes, but it came back through, but I can't remember where it ended up within their principles, but it was definitely in there at some point to explore additional.
Right, and that was, right, in the
Yes.
frameworks, so once we get that.
Yeah.
But again, how do we respond to all of this stuff when we don't even have the documents to look at?
And so did you have success in asking for that meeting to happen
I-
before? Because I think you're absolutely right.
I asked Katie to set that up. I haven't gotten anything back yet.
Right.
I'll follow up.
Thanks.
And one of the things that would concern me if these types of things are online is that it looks, people make that glance like they did with beachfront master plan, that it's a determined thing,
Right.
a given thing. It's not very, very clear that this is draft. This is something very, very apparent that says this is a work in progress.
And back to the hump issue again. I
Yeah.
mean, that was in there, well, we could take down the hump.
Yeah.
Slow down.
Yeah,
And then I got an email saying, well, what's your data point for saying that people didn't want the hump to come down? Take a look at what, 9 people out of this 123 that said, maybe we could look at taking down the hump. So I think we might choose to do that, but let's not start out with the humps coming down.
It's such a hard conversation, the same thing you
Yeah.
guys ran into at the beach.
Yeah.
To get people to wrap their heads around the fact that these are not construction plans.
Right.
And it is contrary to logic, because you're talking about specifics.
Yeah.
Yeah.
And yet, at the same time, you're saying, this is just a general concept of what could go there. And also keeping in mind that, this stuff is arguably 10, 20, 30 years away
someone
from now.
asked
Like, most of the people who object to the hump coming down, and
Yeah.
or want it to stay, including myself, won't be around when that. And furthermore, they don't understand that a lot of these decisions won't be the result of the 7 of us making that decision. It'll be whoever owns that property, in the case of the hump, saying, hey, so we've got this big road coming through my property. I feel like it's taking up millions of dollars of real estate, and could we explore other possibilities, of which I may myself contribute or pay for? I mean, those are such down the road concepts, and people just, I have this conversation, I feel like daily about this, that this isn't that, this is
Someone
just
on, well, someone
idea.
online said, so when are those townhomes coming up for sale?
Yeah, exactly. Right.
See, but I like that they didn't draw it like Disney World, like they did with the beachfront.
Yeah.
The beachfront had it planned
Well,
out.
I think it'll get there.
Yeah.
By
I
the
know,
time
yeah,
they're done, it'll look like,
They had
whoa.
road cross sections to show, well, if it's a boulevard, it's gonna be this, if it's a this kind of street, that.
No, good.
So,
But they also had some great examples of other towns that have done
Yeah.
things and been very thoughtful about things like water runoff and how to manage
Right.
around that and still have it be attractive. So it kind of gets us pigeonholed, to Ken's point, when the whole scope of the discussion is not available for people to see online.
It
And
is,
to
yeah.
see everything that's being talked about and know that this one thing is not the master plan to start getting tomorrow.
It just screams of being rushed.
What?
It just screams of being rushed.
It's not. There's,
No, because if they can't give you all the data up front, then why didn't they have it?
Yeah, and I can't confirm that. If they didn't give us the data, or that, and that may have been the case. They just didn't have it in time for
Well,
us to have
let's
to
just-
post it.
They should have.
Let's be positive, we're still early in the process, and let's make
Absolutely.
sure
but they've
we're,
already shared
flowing.
that in a meeting, so they have it now. Why
Right.
haven't we got it?
Yeah, we need to get that posted. We'll get it corrected.
Anybody else?
Thank you guys
Yeah, thank you
for
very much.
providing this and for being our ears there. Wow.
Any other comments from council? Are you done, sir?
I'm done.
All right. Just a couple real quick ones for our audience. March 12th, 2026, Town Council Strategic Planning Workshop at noon, the Fellowship Hall. March 19th, Town Council regular meeting. March 21st, Cape Charles Day, 10 to 12, community cleanup, 12:30 to 2, picnic in the park. And we're meeting at the gazebo in the morning. And that being said, what?
At the beachfront.
Right.
Well, okay.
Pavilion.
Yeah, but people-
Sorry, the pavilion, I apologize.
I will not be at the planning session. I know Paul is in particular very disappointed to hear that.
I'll carry your thoughts though.
I will not be there either, so,
I have a previously scheduled plans.
yeah, I have work, so.
Oh, man, both of you guys won't be there?
Will not
at which
be there.
event?
At the noon on,
Wow.
Yeah.
The retreat.
yeah, will not be there.
And everyone keeps saying, where are you guys going?
I will be in Cape Charles, but I will not be
Yeah.
there, unfortunately. So yeah, with that, is there a
So
motion
moved.
for adjournment?
Second.
All in favor?
Aye.
Hi.
We are adjourned.